Dạ, bây giờ em xin bắt đầu ạ. À, xin chào mọi người, thì cảm ơn mọi người đến với buổi webinar tháng 3 của VCA. Và như mọi người đã biết thì Cộng đồng Hóa học Việt Nam VCA được lập ra với mong muốn và hy vọng là nơi để mọi người trong ngành hóa chia sẻ những kinh nghiệm và nghiên cứu cũng như kết nối với nhau. Thì đến với buổi chuyên đề ngày hôm nay thì VCA vinh dự nhận được sự đồng ý chia sẻ của Phó Giáo sư Tạ Thu Hằng. Hiện cô đang công tác tại trường Đại học Griffith, Úc. Thì giáo sư Hằng học tiến sĩ về vật liệu sinh học ứng dụng trong vận chuyển thuốc tại Đại học Melbourne và sau đó làm việc tại Viện Tim mạch và Tiểu đường Baker và Đại học Queensland trước khi chuyển đến công tác tại Đại học Griffith vào năm 2020. Thì cô đã được trao một số giải thưởng, trợ cấp và học bổng danh giá như học bổng sau tiến sĩ của National Heart Foundation, NHMRC ECR và Heart Foundation Future Leader Fellowship. Cô nhận được hơn 3,9 triệu đô la trong nguồn tài trợ cạnh tranh từ các cơ quan tài trợ quốc gia Úc cho các dự án nghiên cứu và đầu tư cơ sở hạ tầng. Không những vậy, giáo sư Hằng còn nằm trong ban biên tập và phản biện cho một số tạp chí và chủ trì cũng như đồng chủ trì các hội nghị, thành viên hội đồng của các ủy ban hội khoa học và chuyên gia đánh giá các luận văn thạc sĩ, tiến sĩ, cũng như là chuyên gia bình duyệt cho các đơn vị đơn đăng ký dự án nghiên cứu sinh ở Úc và cũng như quốc tế như là chính phủ Scotland hay là cơ quan quốc gia nghiên cứu Pháp. Giáo sư Hằng còn là thành viên của Heart Foundation Future Leader Fellow và nhóm nghiên cứu của cô hiện đang có 8 sinh viên và một nghiên cứu sinh sau tiến sĩ làm việc về vật liệu nano để chẩn đoán và điều trị các bệnh đe dọa đến tính mạng. Thì cụ thể là lab của cô nghiên cứu về chất tương phản kép sử dụng trong kỹ thuật MRI cho phép tự xác nhận hình ảnh và dẫn đến độ chính xác chẩn đoán cao, đặc biệt là trong chụp ảnh phân tử của bệnh xơ vữa động mạch. Thì ngoài ra, phòng thí nghiệm cũng có thiết kế và phát triển các cảm biến nano MRI thông minh, không chỉ có thể phát hiện mà còn cảm ứng và báo cáo các giai đoạn hoặc là các sự tiến triển của bệnh tim mạch, chẳng hạn như là huyết khối. Và việc phát hiện sớm và chính xác các đặc điểm của các bệnh đe dọa tính mạng như tim mạch và ung thư rất quan trọng trong việc chỉ định điều trị, và biết huyết khối trong mạch máu là cũ hay là mới hình thành thì rất là quan trọng để bác sĩ quyết định phác đồ điều trị. Và các hạt nano cảm xạ dựa trên Iron-Oxide và Theranostic cũng được phát triển trong nhóm. Chúng là vật liệu tiềm năng để chẩn đoán và điều trị các bệnh viêm như là CVD, và một loại hạt nano khác dựa trên oxit sắt và bạc cũng có khả năng hấp thu NIR và cũng được tổng hợp như là một cái vật liệu tiềm năng để phát hiện và điều trị đồng thời huyết khối. Và đó là sơ lược về tiểu sử và nghiên cứu của nhóm cô Hằng. Thì em cũng xin nhắc mọi người vui lòng mute microphone để buổi chia sẻ được diễn ra được suôn sẻ, và các câu hỏi mọi người vui lòng đặt qua khung chat của Zoom hoặc là trên Facebook. Nếu muốn trao đổi trực tiếp với cô thì có thể raise hand và trao đổi trực tiếp với cô. Và bây giờ không để mọi người chờ đợi thêm nữa thì em xin được chuyển mic cho cô Hằng và em xin mời cô ạ.
Ok, chào mọi người. Cảm ơn Nhân đã giới thiệu giới thiệu chị. Thì ok, chào mọi người nha. Thì bữa nay thì mình xin phép là nói chia sẻ những cái nghiên cứu của mình bằng tiếng Anh nha, tại vì có những từ chuyên môn thì cũng không biết dịch ra tiếng Việt như thế nào cho nó đúng, nên xin phép là chia sẻ bằng tiếng Anh. Thì có gì thắc mắc thì mọi người cứ hỏi thôi. Cảm ơn nha. Rồi để mình share cái screen. Các nghiên cứu của mình thì chủ yếu là tập trung vào việc chẩn đoán và chữa trị các bệnh dùng công nghệ nano để mà chữa đoán các bệnh như là bệnh tim mạch hoặc là các bệnh viêm này nọ. Most of my particles are based on iron-oxide. So we develop iron-oxide particle for imaging or diagnostic using MRI. MRI is magnetic resonance imaging. Thì tiếng Việt Nam thì MRI là cái máy chụp từ đó. And we also develop nanomaterials for treatment of disease or for therapeutics of disease. Can you hear me clearly?
Dạ nghe.
Yeah. So based on iron oxide, we develop dual MRI contrast agent to detect disease such as thrombosis or atherosclerosis. So you can see here the particle we developed have dual contrast. It means in MRI we can see in both T1 and T2 signal. So I will talk about it a bit more later. And based on Iron-Oxide, we also developed MRI nanosensor to not only detect but also provide us information on the progression or the age of the disease. And here we focus on thrombus or the blood clot in the blood vessel. Thrombus is the blood clot. And based on Iron-Oxide, we also develop some hybrid nanoparticle. Here is the hybrid between serum oxide and Iron-Oxide. So this particle can be used as the Theranostic particle. Theranostic is the combination between therapy and diagnostic, between detection and treatment of the disease. And we also develop the hybrid nanoparticle between gold or silver and Iron-Oxide. So this is the particle, how it looks like, and this particle are used as the Theranostic particle as well. And also we use this particle to develop reversible blood clotting agents, the particle that can stop the blood, stop the bleeding. So as I said, my research, our research focus on cardiovascular disease. So you can see here, atherosclerosis or atherothrombosis is one of the main disease amongst cardiovascular disease. And atherosclerosis is the condition where we have fat build up in the vessel wall, in the wall of the blood vessel. So you can see here, fat build up and then enlarge the area here. So this area we call atherosclerotic plaque. And this plaque can be unstable and it can rupture. When it rupture, when it break, it induces the formation of thrombus. And as I said, thrombus is the blood clot. And when we have the blood clot in the blood vessel, it can block completely the blood vessel and then block the blood flow to the organs. So for example, if we have the clot happen in the artery in the heart, we will have a condition called heart attack. So no blood flow to the some part of the heart and cause the damage of the heart. And if we have the blood clot in artery or the blood vessel in the brain, we have a condition called stroke. Tiếng Việt mình gọi là đột quỵ đó. So it's the clot here stop the blood flow to some part of the brain and then can cause the death of the cells and the damage of the brain. So you can see here, so the plaque and the clot. So so on the surface of these the plaque or the thrombus, there are always the expression of some special biomolecules. So these biomarker, we call biomarker, they are the special biomolecules that are present only on or in the disease area or in this area and not on the normal cells or normal tissue. So in my research, we always try to use, so this biomarker we can say is biomarker A, and then or biomolecule A. And in our research, we try to use another biomolecule we call B. We attack biomolecule B on the surface of the nanoparticle, and the biomolecule B had a function that had a characteristic that it can bind specifically to the biomolecules A on the disease site, for example, on the thrombus here. So we do that for targeting purpose, to target our particle to the disease area. So then it can focus to the disease area, not to limit the to increase accumulation of the particle to the disease area. Okay. So as I said, we do targeted delivery of the nanoparticle, and to be able to do that, we usually engineer the antibody. Antibody is the biomolecule that I just mentioned, or the biomolecule B, the one that we use to target the particle to the disease site. So we usually engineer this biomolecule with LPETG motif at one end of the molecule by PCR, and then we label our particle with a peptide. Here we call GGG peptide, and then we use sortase. Sortase is an enzyme. We use sortase to catalyze the reaction between LPETG and GGG to give us the conjugated product between the particle and the antibody or the targeting biomolecule. This approach can also be used for live cell as well. So we also target live cell to the disease site using this approach. But here I will not talk about the cells. I only focus on the nanoparticles. So this is the cover page of one of our image that we got. So here you can see the green objects are the aggregate of the platelets or the thrombus, the blood clot, and the orange object are our particles. So you can see that the particle by specifically on the surface of the aggregation on the blood clot or the thrombus. And these are the video just to show you the specific targeting of our approach, our nanoparticles. So here, these are in live mouse. So this is the blood vessel of live mouse, the blood vessel, and along the blood vessel, you can see the thrombus here and here. And in this mouse, we inject non-targeted particle, this mouse with targeted particles. So you can see here, only one particle died but then run away. But in the case of targeted particle, we can see that lots of particle come and bind on the surface of the thrombus. So they accumulate here. Do you see the mouse that I move? Do you see the curve?
Yes.
Yes.
Yeah, right. So using this approach, we develop negative contrast iron-oxide nanoparticle for detection of blood clot. Negative contrast iron-oxide particle is the particle that can provide a dark contrast or the black signal, the black contrast in the image of MRI. So that's why we call negative. We have another type of contrast agent is positive contrast. Positive contrast means it will show up as bright or white in the image. So here we test the nanoparticle in vivo in the mouse. So here we use the mouse model with the thrombus or the blood clot in the carotid artery of the mouse. So you can see here, every human, every person or every mouse had two carotid arteries in the neck area. Carotid arteries are the artery that bring the blood from the heart to the brain. So you can see here the mouse had two carotid arteries. So we did some minor surgery to expose the artery, and then we use ferrous chloride, a chemical, to induce the blood clot in the carotid artery. And then we inject the mouse with our nanoparticle, and then we do MRI imaging to see whether we can locate the blood clot or not. So here how the MRI image look like. So you can see here is the cross-sectional image of the neck area of the mouse. And you can see two carotid arteries here. And this one, the artery in the red circle is the artery with the clot. And this one is just a normal artery without the clot. And this image is before the injection of the particle, and these are after the injection of the particles. So you can see here, after the injection of the particle, we can see the blood vessel with the clot become darker here. Can you see that?
Yeah.
Yep, this is because of the binding of our particle to the clot and then induce the dark contrast here. So the next one is dual positive and negative contrast iron oxide particle. So this particle have both positive and negative contrast. It depends on the setting of the sequence that we use in the imaging. So we call basically there are two common sequences that we use in MRI imaging. It's T1 weighted imaging and T2 weighted imaging. So you can see this particle is very tiny, only 3.3 nanometers. And in T1 weighted imaging, we can see that as we increase the concentration of the particle, the signal increase, or you can see that it's become brighter. And in T2 weighted imaging, as the concentration of the particles increase, we can see the reduction of the signal, or it becomes darker. So that's why it is called dual positive and negative contrast iron oxide particles. The reason that we want to use this particle is because it can provide the confirmation of imaging. Because if we have only one imaging modality, then, for example, if we have only one negative contrast effect, then when we see the darkening of the image of the area in the image, we cannot be sure that it's really because of the clot is there or not, or maybe it's just the imaging artifact. But if we had two imaging modalities here, it is the confirmation, because it confirmed that it's really had a clot there. So this is the beauty of this nanoparticle. And again, we also label the particle with the special biomolecule that can help to target, to deliver our particle to the disease site or the clot area, the clot surface. And again, we tested the particle in the mouse model. So you can see here, A is the mouse injected with the targeted particles, and B is the mouse injected with the non-targeted particle. Non-targeted particle is the particles that cannot bind to the clot. And in A, you can see the first graph is T1 weighted imaging, and the second graph is T2 weighted imaging. And again, the blood vessel on here is the carotid artery as well. So again, on the left is the artery with the clot, and on the right is the artery without the clot. And the artery in the green square is the zoom-in image of the artery with the clot here. And you can see these are before injection, and these are after the injection. So you can see after the injection of the particle in T1 weighted imaging, you can see the bright signal in the artery compared to before injection. And over time, we see the bright signal. And in T2 weighted imaging, you can see that the artery with the clot become darker or become black after around 100 minutes compared to the one before injection. And in the mouse injected with the non-targeted particle, we didn't see the same effect here as we see with the targeted particles. Can you see the image clearly?
Yes, we can.
Thank you. So this is the ex vivo validation of the binding of our particle in the clock. So after the imaging, we sacrifice the mouse and we cut the vessel that had the clock out, and then we do the imaging of the vessel. So this is the piece of vessel with the clot, with the blood clot. And this is the frozen image of the blood vessel, and this is the overlay image. And you can see that here the frozen, because we also label our particle with frozen molecules, so we can see the frozen signal here. You can see here, this is the targeted particle. You can see very strong signal, and this is the non-targeted particle, very low signal. So it confirmed that the targeted particle by a lot on the surface of the clock. There are some non-specific binding of the non-targeted particle to the clock as well, but very low compared to the targeted particles. And these are just the histology image of the blood vessel. This is the blood vessel without the clot, and this is the blood vessel with the clot. So this is the cross-sectional image of the blood vessel. So that's why you see this shape is not like long shape, because it's the cross-sectional image of the blood vessel. And the next one is MRI nanosensor. So as I mentioned before, this nanosensor can not only detect the disease, help us to detect the disease, but also provide us very helpful information on the progression or the stage of the disease. So it's very important because it's help the doctor to decide a suitable treatment. And here we focus on the thrombus. So the age of the thrombus or the blood clot is very important because the treatment for the new clot or the treatment for the old clot are different. So here is the design of the particles. The core is iron-oxide and the outer layer is here gadolinium. And gadolinium are connected with the core by a peptide. This peptide can be cut specifically by an enzyme we call thrombin enzyme. So that enzyme is only present on the fresh thrombus or the fresh blood clot and not present on the old blood clot. So that's why we employ this to distinguish between the old clot and the fresh clot. So this is the working mechanism of the nanosensor. So let's say we have two contrast materials here, T2 contrast material and T1 contrast materials. T2 contrast materials example is Iron-Oxide nanoparticle, and T1 contrast material example of this is gadolinium, or the positive contrast material. This one is negative contrast material, Iron-Oxide. So if we place these two contrast materials close to each other, the magnetic field generated by the T2 contrast material can interfere with the relaxation of the T1 contrast materials, and then can interfere the signal produced by T1 contrast materials. Is the working principle. So here you can see we have the blood vessel here, and we have chronic thrombus or the old clot, and we have here the acute thrombus or the fresh clot. And if the nanosensor bind on the surface of the old clot, because old clot doesn't have any enzyme thrombin, so there is no cutting of the peptide here. The nanosensor just stay intact. So so T2 affect the relaxation time of T1, so we cannot see the signal from T1 material or gadolinium here. We only see the signal from T2 or the signal from iron-oxide particle. So we can only see T2 signal in MRI and T1 is up. And if the nanosensor by on the surface of the fresh thrombus or the fresh blood clot, because fresh blood clot has enzyme thrombin, it cut the peptide here. And when it cut the peptide, this part or the T2 material or iron-oxide particle is washed away by the blood, and then only the T1 material or gadolinium stay on the surface of the particle. So then now the signal from the T1 particle is restored. And we'll be able to see the signal, T1 signal, but T2 is up. So as I mentioned, if the nanosensor bind to a fresh thrombus, we can only see T1 signal, T2 is up, and because we also label the particle with frozen molecule, Tandra here, so the frozen signal is on as well. And if the nanosensor bind on the on clock, T1 is up, T2 is on, and the frozen signal is on as well. So here you see is the thrombus or the clot in the epidote tube is at the bottom of the tube. And here is the fresh clot, and here the bottom row is the old clot. And you can see because the fresh clot have thrombin enzyme, it activates the nanosensor. So you can see in T1 weighted imaging, we see the bright signal on the surface of the clot. And in T2 signal, we also see some signal as well, because of the high amount of nanosensor we use here. And in frozen imaging, we see a frozen signal on the surface of the clot. And in the case of on clot, because on clot doesn't have any thrombin enzyme, the nanosensor are not activated. So then we cannot see the bright signal in T1 weighted imaging, but we only see the dark signal in T1 weighted imaging. And we see the frozen signal on the surface of the clot. It confirms the binding of our nanosensor on the clot. So we are in the process, progress to develop the mouse model with the old and the fresh clot to be able to test our nanoparticle in vivo in mouse model. The mouse model for old and fresh clot is not easy, so we are currently developing this mouse model to be able to test our nanoparticle or our nanosensor. And this is the femoral vein of the mouse. So the femoral vein is the vein on the type of the mouse. So we try to develop the old clot and the fresh clot in this femoral vein of the mouse to test our nanosensor. And this is still an ongoing project. So next, I share with you some research on the hybrid nanoparticles. Here we had the hybrid particle between iron oxide and cerium oxide. So you can see here, this is the particle. The size is around 50 nanometers, and the core is iron oxide. The outer layer is the cluster of cerium oxide. So the reason we used this particle is because we have iron oxide here is for imaging, for MRI imaging to detect the disease, and we have cerium oxide here for the treatment of the disease because cerium oxide have antioxidant and anti-inflammatory effects. So iron oxide can quench the production of ROS. ROS is reactive oxygen species. So cerium oxide can quench reactive oxygen species. So that's why we employ cerium oxides in our nanoparticle. Reactive oxygen species are a group of unstable molecule that contains oxygen that easily react with other molecules in the cells and can cause damage to the cells and other organs in the body. So example of reactive oxygen species are silver oxide, hydroxyl radical, hydrogen peroxide, or hypochlorous acid. So reactive oxygen species are responsible for quite a range of different disease. For example, liver inflammation or hepatitis, atherosclerosis, or rheumatoid arthritis. And here in this project, we focus on liver inflammation and fibrosis. So this is the healthy liver. So if the liver is exposed to different external trigger like toxicant or high-fat diet or alcohol or any infection, these can activate hepatic stellar cells, and when these cells are activated, they recruit inflammatory cells such as macrophage or Kupffer cells to the area, and these cells will produce ROS or reactive oxygen species, and these reactive oxygen species trigger the production of a range of inflammatory biomolecules, and these molecules again induce or trigger the transformation of hepatic stellar cells to myofibroblasts, and these cells again produce collagen and can cause liver fibrosis that can damage the liver. So we can see here cerium oxide. So cerium in cerium oxide can be present in two different states, tetravalent or trivalent. So we can see the beauty of this particle of cerium oxide is it can regenerate between tetravalent cerium and trivalent cerium. And for example, here, trivalent cerium can react with silver oxide and then to produce tetravalent cerium. And then tetravalent cerium can react with hydrogen peroxide and return to the trivalent state. So it can keep regenerating like this, and then during this process is react with reactive oxygen species or quench the reactive oxygen species. So here, because it had MRI, because it had Iron-Oxide, we can do MRI imaging. So these are just the cell at the bottom of the tip. Without the particle, we see nothing, but with the particle, we see the dark signal here. And because it has cerium oxide, it can quench ROS or reactive oxygen species. You can see here they are the cells without the particle, and here the cells with the particles. So the fluorescent intensity here tell us the level of the ROS. The higher the fluorescent intensity, the higher the ROS level. So without the particle, the ROS level is very high, but in the presence of the particle, the ROS level is very low. So that is the core shell nanoparticle, core is Iron-Oxide, and shell is the cerium oxide. And we also developed the nanococktail, the cell assembly nanococktail between Iron-Oxide and Iron-Oxide. So this particle is quite the procedure to synthesize this particle is quite simple and easy. It's just based on the positive charge of hydrogen and the negative charge of Iron-Oxide particle and a cerium oxide particle. So it's just the cell assembly between hydrogen and Iron-Oxide and cerium oxide. So again, because the particle has iron oxide, we can do MRI imaging. And because the particles has zinc oxide, we can see that it can quench ROS production in the cells. And we show here that the particle can provide us the anti-inflammatory effect as well to reduce inflammation in the cells. So here we test different inflammatory biomarker, and here we have TNF-alpha and COX-2. You can see that in the presence of the nanoparticle, the level of TNF-alpha decrease compared to here. So here we have, here is the one without any trigger or LBS. We use LBS here to induce the inflammation of the cells. And this is without LBS, this with the LBS. So you can see with the LBS, the inflammation or the level of TNF-alpha significantly increased. Then in the presence of our particle, this level decreased. And similarly, the particle reduced the level of COX-2 in the cells as well. However, we did not see any significant reduction of IL-6 and INOS in the cells. And then we tested the particle in a mouse model of liver inflammation and fibrosis. So here we use carbon tetrachloride to induce the inflammation of the liver and induce the formation of fibrosis in the liver. And here the result of our in vivo study. So here we have the mouse, and the liver area is in the middle of the mouse here. And these image are the cross-sectional image of this area, the tummy area of the mouse. So you can see here, these are the liver area, and these are the first row are the before the injection of the particle, and the bottom row is after the injection of the particle. And this is just with the lower concentration of the particle, and this one with the higher concentration of the particles. So you can see after one day after the injection of the particle, we can see that the liver, the signal in the liver is darker. You can see it's darker compared to before the injection of the particle. Yep, you can. So we analyze the signal here, and we can easily see that after the injection, we see that the signal significantly reduced compared to the baseline before the injection of the particle. We also tested the whether we test whether the particle can reduce the inflammation at the liver or not. And again, we test different inflammatory biomarker. So we test the level of TNF-alpha, COX-2, and INOS as well. And interestingly, we see that our particle can significantly reduce the level of these inflammatory biomarker down to the baseline level. So the baseline level is the level of these biomolecule in the normal liver. The liver without inflammation is the baseline, and this is the liver, the diseased liver. And in the presence of our particle, the level of the TNF-alpha reduced. And at high concentration, we can see that it reduced to the baseline. The same for COX-2 reduced to baseline, and the same for INOS as well, reduced to baseline. So it shows that our particle can reduce inflammation in the liver of the mouse. So these are just the histology images to show us whether our particle can reduce fibrosis in the liver or not. So here is the baseline or the liver of the normal mouse, the normal liver, and this is the diseased liver. This one is the diseased liver. The mouse that that were treated with carbon tetrachloride, you can see that loss of fibrosis in the liver compared to the normal liver. And then this is with the low concentration of the particle, and this is with high concentration of our particle. So you can see at lower concentration, we can see some reduction of fibrosis as well, but not significant compared to the high concentration of the particle. We can see that nearly like the number of fibrosis or the level of fibrosis in the liver is significantly reduced compared to the diseased liver here without the treatment of the nanoparticles. So this is another example of the hybrid nanoparticle that we developed in our lab. So this is silver-coated iron-oxide nanocluster, and we developed this for Theranostic of thrombosis. As I mentioned previously, Theranostic is the combination between therapy and diagnostic, and we use this for thrombosis or for the blood clot. The size of the particle is around 100 nanometers. So here, so the particle, the core is iron oxide, and the outer layer is silver. So because it's iron oxide, it can be used for MR imaging, and because it has silver, we show that silver can quench reactive oxygen species or ROS as well. So it has anti-ROS effect. And we use this particle to trigger photothermal effect, and then this can be used for thrombolysis or to dissolve the blood clot, and can be also used for cancer treatment to destroy the cancer, the tumor. It's just how the particle looks like. So the particle size is quite uniform, and it had the shape of like a nano on like the popcorn. And this particle have the very strong absorbance, ranging from around 400, 350 to the infrared range, very strong absorbance. So because of that, we employ the laser at around 700 or 800 nanometers for our treatment purpose that I will mention later. So because the particle have iron oxide, it can be used for MRI. You can see here, as the concentration of the particle increase, we can see the signal increase as well. The dark signal increase, and you can see it become darker or blacker. And we show here it can quench the level of ROS in the cells. Here, it's just in the buffer, we can see it quench the ROS, and then we test whether the particle can quench ROS in macrophage cell or not, and we can see that it significantly reduced ROS level in macrophage. And again, here the fluorescent image tells us the level of the ROS. The higher the fluorescent intensity, the higher ROS level. So this without the particle, and this with the particle, very low ROS level here compared to the one without the nanoparticle. And we will show that the particles are not toxic to the cell at the concentration that we use in our study. So the particle, because it's an MRI effect, right? We can do MRI imaging. So we check here whether it can bind on the surface of the blood clot and help us to image or detect the blood clot or not. So again, we had the clot at the bottom of the ependot tip of the tip. And this is without the particle, so you see nothing on the surface here. But this one with the particle, we can see the layer of black layer on the surface of the particle. Is because of the binding of our particle on the surface of the gut. And here because the particles had a strong absorbance, especially in the infrared, near-infrared range. So we use a laser light. Here we use 808 nanometer laser light to trigger the photothermal therapy to lyse the clot. Photothermal therapy is like we use a light. We use a light. We put a light to the particles, and because the particle can absorb the light at the wavelength that we use, so the particle transfer the light energy into heat energy, and that heat can kill the cells. Or here we show that it can lyse the clot. So here, for example, here we had the control blood clot here without the particle and without laser treatment, and here just with PBS, and here with the particle, and we treated this clot with the laser light, and we can see that. So here the concentration of the particle increased. We can see that in the presence of our particle and combined with the laser treatment, we can see that the clot size significantly reduced. Or we show here that the combination of our nanoparticle and the laser can induce the thrombolysis or lyse the blood clot, reduce the blood clot size here. So we propose that this effect is caused by what we call acoustic cavitation. Acoustic cavitation is the phenomenon that say the local area, one local area in the tissue next to the nanoparticles have a significant increase in the temperature. So then it the liquid or water in that local area vaporize quickly and form the microbubble, and this microbubble can burst, and when they burst, they release the energy. This energy is strong and then can help to destabilize the blood clot or lyse the blood clot. Okay, you can see again, photoacoustic is acoustic cavitation. So here in our lab, we also employ this particle for cancer therapy because in the presence, so we show here that in the presence of the particle and the laser, we can kill the cells. And my postdoc, Munshi, is currently working on this direction, cancer treatment using our silver-coated iron-oxide particle. So we expect that we will inject the mouse with the tumor here. We inject the mouse with our particle, so the particle will accumulate in the tumor, and then we will use a laser, put the laser light on the tumor, and then it can induce phototherapy that can kill the cancer cells and then can reduce the tumor. It's the hypothesis. We show that these particles do not stay long in the body. So you can see here, we check the particle within about a week, and after one day after injection of the particle into the mouse, we can see that the level of particle in the spleen, the blood, and the liver are high. The level are high, but then after one day, it reduced to the baseline level at 7 days after the injection. So it's a good sign because the particle can be excreted out of the body and will not stay long in the body and will not cause any significant negative effect on the body. And we also collect the organs of the mouse after we injected the nanoparticles into the mouse to check whether the particles cause any damage to the organs of the mouse or not. And here we check the heart, the kidney, the liver, the lung and the spleen of the mouse, and we did not see any significant toxicity on the mouse organs. So it somehow show that our particles are quite biocompatible in the mouse at the dose that we use and the dose that that's the dose that we use in our study. So besides silver, we also have gold-coated iron-oxide particles. So these particles are developed for theranostic of thrombosis as well. So other projects using the same particle, gold-coated iron-oxide particles. So Hương is currently working on this particle and develop this particle as the clotting nanoparticles for emergency treatment of bleeding, to stop the bleeding. We also have project on polymeric nanoparticles for the treatment of vascular calcification. Vascular calcification is the buildup of calcium in the wall of the blood vessel, and that calcification can harden the blood vessel. So here, this project is we try to treat that condition to resolve the vascular calcification. So the beauty of this particle is it is stable at pH 5, but then when we inject, when we put the particle in neutral pH or physiological pH, pH 7.4, we can tune the dissolution, we can optimize, we can modify, we can tune it so then that the particle not dissolve for around 5 to 10 hours, but then after 5 or 10 hours, it starts to dissolve and release the polyamino acid that can inhibit calcification and dissolve hydroxy apatite. Hydroxy apatite is a form of calcium in the vascular calcification condition. And we also have project on cardiovascular disease on microfluidics device. So this is the device that we developed. It's quite tiny. So this is in collaboration with Professor Nam Trung Nguyễn and Dr. Chung Jiang. And this is one example of that device. So you can see here, so this channel will mimic the blood vessel, and you can see that we can develop this device to have the blood clot along the channel to mimic the blood clot in the blood vessel. So this is very useful for the study of like drug screening or drug delivery, drug targeting, nanoparticle targeting, or to study the mechanism of disease. So this is just one example. And that's it for my talk today. So here I just want to acknowledge all of the people involved in the project, the organizations, and also the funding agency that help to fund the projects. And thank you very much for your attention.
Thanks a lot, Professor Ta. I guess I speak for everyone here to give you an ovation for a very impressive talk. So would you be ready to answer a few questions from the audience?
Yeah. Mm-hmm.
So if anyone here on Zoom have a question for Professor, please either raise your hands, turn on your videos, or ask directly. So I'm gonna be relaying a few questions from Facebook now. This first question is from Jen Jen. I guess it's like a 4-part question, so I'm gonna read each one for you. She asked, for the inflammatory disease, did you measure granzyme B level?
No, we don't. We didn't.
Okay.
Mm.
How stable are these particles upon entering the animal model?
Yeah, it's a good question. We don't know yet. We don't know how long it can be stable, how long it stay in the particle. So I think you asked about the particle that we use for liver inflammatory disease, the combination between cesium oxide and iron oxide particle, so that hybrid particle. So if you ask about that particle, we don't know yet how stable the particle in the body, in the mouse.
Right, but we probably don't want it to be too stable, right? Because
yeah,
you know, right.
We want it to be excreted out of our body, not stable for very long.
Correct. The next part of her question would be, how will these particles be delivered safely to patients? Is it going to be via local injection or infusion or something?
So all of my particles, we do intravenous injection. We inject directly into the blood vessel, to the vein.
I see. And the final part of her question would be, what are the expected reactions or side effects of these injections, basically?
So this question a bit broad. So in our study with these mouse, we haven't seen any significant effect yet, for example, but it's just a very preliminary study. So to study the long-term side effect, we need individual study or separate study. It can be a PhD on that to study the long-term effect. It's not so, but if you see the particle, the hybrid particle between silver or gold iron oxide particle that I show, that particle, we did not see any damage to the organs. And as I mentioned in my presentation, the particle can be, they did not stay long in the body after 7 days, so we cannot detect them anymore. And we didn't see any significant effect. And other particles, so you can see that we develop quite lots of particles. So some other particles, we still don't know any effect yet, the long-term effect in the body yet. But within the short term, when we test in the mouse, we did not see any toxic. We did not see.
I see. Very impressive. Over here, there's Tuấn who raised hand for a question. So Tuấn, can you please either turn on your video to ask directly, or do you want me to read your question?
Chị Hằng, anh Tuấn này. Em có một câu hỏi là cái nanoparticle của chị nó khá là nhỏ, nhưng mà trong cái solution này nó có cái tendency là nó sẽ aggregate, để nó form một cái particle lớn hơn nữa, thì chị bằng cách nào để chị prevent that from happening?
Em nói trong solution nào?
Thì khi mà trong blood thì nó sẽ có khả năng là nó sẽ aggregate, tức là nó form một cái particle lớn hơn. Thì cái sự đó, cái việc đó nó có xảy ra hay không, và làm sao chị để chị ngăn cái điều đó xảy ra?
Thì những cái particle của chị thì chị đều stable, nó stabilize, kiểu như là stabilize nó với polymer. Ví dụ như chị dùng PEG để mà stabilize the particles, thì chị chưa có thấy cái sự mà big aggregation in the blood or in physiological solution. Thì em phải stabilize the particle.
Một câu nữa là lúc mà chị đi develop cái blood clot trong một cái con mouse, thì chị để nó trong thời gian bao lâu, hay là chị tức là lúc đó con mouse nó còn sống không, hay là chị
con mouse còn sống em?
Thì chị để nó sống trong bao lâu thì chị mới bắt đầu làm thí nghiệm, hay là hay là chị bắt đầu làm thí nghiệm ngay lập tức?
Ví dụ như là nếu mà chị cái thí nghiệm mà chị làm cái clot ở trong carotid artery á, thì chị mua mouse và nó về tới chị để nó khoảng chừng 3 ngày, từ 3 đến 7 ngày là được, nhưng mà cỡ 3 ngày là được rồi, thì cho nó ổn định với lại cái condition trong cái phòng lab mà mình chứa nó đó, cỡ 3 ngày thì mình bắt đầu mình làm thí nghiệm được rồi. Còn những cái thí nghiệm mà nó cần nó more sensitive hơn á, thì em có thể là khi mà em mua mouse về rồi em giữ nó trong vòng 7 ngày trước khi em start cái thí nghiệm.
Ôi, tức là chị mua con mouse về thì con mouse nó có cái blood clot chưa, hay là chị mua về rồi chị mới
chưa. Con mouse nó bình thường, chị induce cái clot. Trong cái talk chị có show em là chị phải do một cái surgery ở đây nè, ở ngay cái cổ đó, để mà mình expose cái carotid artery ra đó, rồi mình mới bỏ chemical lên, mình induce cái blood clot ở đó.
Cảm ơn chị.
Vậy thì cái thời điểm mà chị làm cái surgery đó là rồi chị chích cái chất đó vào thì mouse nó vẫn còn sống.
Đúng, mouse còn sống hết.
Sau đó chị bắt đầu chích cái nanoparticles của chị vào, và chị bắt đầu cái fluorescent cái thứ là con mouse vẫn còn sống từ đầu đến cuối.
Đúng, con mouse còn sống từ đầu đến cuối. Nó mà chết rồi là nó không còn blood flow nữa, là cái particle mình nó không có tới được cái clot. Nó phải còn sống.
Em có một câu hỏi nữa là lúc mà chị dùng cái laser để treatment cho cái blood clot đó, thì nó có damage gì với các cái cell xung quanh không?
Ở đây là chị dùng ferrous chloride là cái chemical á, nó không damage thì mình phải minimize nó, là một cái kỹ thuật thì nó cũng không phải ai cũng làm được, mình phải có training để mình làm được cái đó.
Dạ vâng.
Thì mình nó không có cause cái major damage to cái body tissue.
Dạ vâng, cảm ơn chị.
Có một câu hỏi liên quan tới cái laser mà chị dùng ở trong chị bảo là cái I think it's the cerium oxide that absorbs around the infrared region. Is that the one? So then it actually absorbs all over from 600 to 800. So why do you have to use 800 nanometer? Why not 600? What's so specific about that wavelength?
So that one is the silver coated iron-oxide particle. So the reason that we use 808 nanometers, we use the wavelength in the near infrared range, is because that laser can penetrate deeper into the tissue. So if you use lower wavelength, it cannot penetrate deeper in the tissue.
I see.
Yep.
Ở bên Facebook có một câu hỏi của bạn Phạm Toàn Thức. Thank you, Professor, for the nice talk. My study is on life science field. I have a question regarding delivered treatment particles to the tumor cells. What is the method you used and how effective is the method?
So in our tumor project, so with the clot project, the project with the clot, we do intravenous injection, like I said. And for the tumor project, we do intravenous injection as well. We inject the particle directly into the vein of live mouse.
And how can it be specified to the tumor cells? As it would go around.
Yep. It go around, and so we always do targeting. So we don't just use bare nanoparticle, but we always label the particle with the special molecule, like the antibody. That the antibody is the molecule that can bind specifically to the biomarker on the tumor or on the clot. So it can like nó giống như là một cái dẫn đường vậy đó, là chị dùng cái biomolecule, chị có cái particle đúng không? Rồi chị phải bỏ một cái biomolecule mà cái chất dẫn đường ở trên đây, thì cái chất dẫn đường này nó biết là chỗ nào có tumor, chỗ nào có clot, thì nó sẽ nó đưa cái nanoparticle tới chỗ đó. Thì mình nói nôm na là vậy đó.
Trong Facebook cũng có một câu hỏi của bạn Kim Trân Trần. Thank you, Professor, for the talk. For the detection using iron-oxide nanoparticles. After detection, is there a way to remove the nanoparticles out of the cell?
So we don't have any special way to remove the particle out the cells after injection of the particle in the body. Yeah. So the secretion of the particle out the cells or out the body is rely on the mechanism of the body.
And I guess
So
that's
we cannot do anything.
Yeah, that's the most drug delivery method uses relies on the body function to get rid of the medicine, right?
Yeah.
So, chị Hằng, lúc mà chị thí nghiệm ở trong 7 ngày thì nó đi ra hết rồi, thì trong cơ thể người chị có effect là nó sẽ nhanh hơn như thế không, hay là nó chậm hơn?
Chị không biết, là chị cũng không trả lời được câu hỏi này em ơi. Dạ, không biết được.
Còn những cái phương pháp ví dụ như drug delivery trong cơ thể người, ví dụ như người ta làm thí nghiệm trong chuột trước rồi sau đó người ta mới thử nghiệm trên người, thì lúc đó thường là nó nhanh hơn hay nó chậm hơn? Chị có literature review về cái đó?
Thử trên chuột trước rồi phải tới những cái con vật bự hơn, ví dụ như là lợn, heo, khỉ gì đó, rồi mới tới người. Người là phút cuối. Thì nó cũng khó mà đoán được lắm. Tại vì cái model ở trên chuột thì nó không nhiều cái model nó không có thật sự là nó giống với lại human body. Thì nhiều mà mình test trên chuột được nhưng mà ra người thì không được, thì vậy nên nó có rất là nhiều trial mà nó fail. Thì nó thử trên chuột hay thử trên động vật là tốt work, nhưng mà cái người thì không được thì nó fail. Thì mình thấy là tuy là cái nghiên cứu trên cái lĩnh vực nanomedicine nó rất là nhiều, nó phát triển rất là mạnh, rất là nhiều nghiên cứu, nhưng mà đâu có mấy cái nó ra được tới trial mà thành công đâu.
Cảm ơn câu hỏi của anh Tuấn. Ở trên Zoom, anh nghĩ chắc các bạn này tên là Lâm. Thank you, Professor, for your talk. I have one question regarding the ROS quenching. I noticed that you use two different nanoparticles, one containing cerium and the other containing silver for RS quenching. I have the same question to you. What are the differences between these nanoparticles and which one is better?
So the difference between this particle is one particle we use serum oxide and the other particle we use silver. Which one is better?
When do you use the silver and when do you use the cerium? Because they both have the RS quenching properties.
So we don't really know when we use which one. We just show here that we can develop these novel nanoparticles and it had this function. So it's opened the doors, like multiple doors for other people to develop and to continue that. So far we don't really know which one is better, because in our research we show that both of them work quite well.
But
they still.
As I recall, the cerium oxide particles is more specific to ROS scavenging effect, but the silver one can be used for cancer and whatnot, right?
So serum oxide, there are quite lots of research and they investigate on the anti-ROS antioxidant effect of serum oxides. But for silver, the anti-ROS effect of silver, not many people study about that. So serum oxide is more like widely studied than silver in terms of antioxidant effect.
Yeah, thank you, Ji. Another question from Thanh Lộc Nguyen from Facebook. Thank you for the great talk. I am so interested in the hybrid cerium iron oxide nanoparticles for the treatment of fibrosis. My question is, how often did you inject the nanoparticles? What was the dose of the nanoparticles, and did you observe the reduction of ROS in vivo in the liver?
Okay. So in vivo, so that in vivo study, we cannot measure the ROS level. what we measure there is we measure the level of inflammatory biomarker. We cannot measure ROS because, as I say, ROS is very unstable. They are very unstable. So we cannot detect ROS in vivo, because even if we had ROS in the organs, after we collect the organ, we do all the procedure, ROS gone. They are not stable. We cannot detect. They are not be there for us to detect. So what we detect is the inflammatory biomarker.
What about the dose and the frequency of delivery of the nanoparticles?
That article, that study, we inject once. So let me share the screen again.
Right.
So this one we inject only once, and these are 2 doses. So the very low dose, low dose, and higher dose. So this is the dose: 3 microgram cerium, but 10 gram of mouse.
I see. Thank you. On Zoom, I guess his name is Vũ Quang Công. Raised hand. Do you want to? Yeah. Hi. You muted though.
Oh, sorry. Hi. Hello. I'm from Osaka University. I'm a student. Thank you very nice talk. I learned a lot from you. But as you know, that MRI is not very common machine in the every laboratory. For example, my lab is usually use fluorescent microscopy. So do you think that we can somehow modify your particles and use with the microscopy? Is this possible? For example, like your particle are linked with some fluorescent dye, and then you can use this for study? So most of my particles are labeled with fluorescent molecules, so definitely we can use fluorescent imaging to image the particle and the cells. Yeah. Okay. But if you want to do the in vivo study, fluorescent molecule is very challenging and difficult for you to do in vivo imaging, because you will have lots of like autofluorescence of the tissue. So you cannot see. Yes. Yeah. So usually we have to use the infrared fluorescent dye, like to avoid autofluorescence and also enhance the penetration to the tissue. Yeah. If it's possible, can I have another question, please? Yes. In this slide, I saw you test the silver oxide particles. Is it only on the surface of the cloth? Is there any reason why it's only on the surface of the cloth, it's not inside the cloth? So because we had a cloth here, right? And then we incubate the cloth with the solution of particle. So the particle just bite on the surface of the cloth. The particle cannot penetrate into the cloth. Yeah. Okay. So is that because of the size of the particle? Is that because of the size of the particle is quite big? Is it not penetrating the cloth? It's not really because of the size. So we try with very small particle, like only 3 nanometers, and we also try with the large nanoparticle, around 100 nanometers. But we still see that the particle bite on the surface of the cloth. So if you look at the literature, you can see that some particle can penetrate into the cloth, but those particles are not labeled with binding molecule, so not targeting. So I think that because we label our particle with the binding molecule, and when we put the particle on it in the solution in contact with the cloth, the particle, because of the binding molecule, they just bind quickly on the surface of the cloth. They had no chance to penetrate. I see. Yeah. And you also use laser to heat up the particles that produce heat, and it can like burst the cloth. But I'm curious about how about the stability of the particles under such high condition. For example, usually when I use carbon nanotubes or gold nanoparticles with the high laser power, for example, after few let's say few seconds or milliseconds, the particle broken. Do you observe any happen in the silver particle? And also because I'm concerned about the reproducibility, like many cycle of the heating.
We don't see. We have. So you control, you vary the setting and the condition of the laser. You vary the power and the time, and you still see.
Yes. So in your case, how strong is the laser power?
So we had a laser that can go up to around. I don't remember exactly. I had to check with my student, but I think it's up to around 2 watts.
Oh, that's a lot, right? 2
yeah,
watts.
But we can adjust. We can make it lower, so it's from 0 to 2. Yeah.
Yes. Did you measure the temperature increase under your condition? How much is that?
So, of course, if we use very high power and long time, the temperature can increase very high, to 20 or 30, like more than 20 or 30 degrees.
Wow, that's
that's why we have, that's why we had to like vary the power, like change, modify, like optimize the power and the time. So because we don't want it hit up too high, it damages the surrounding tissue.
I see. Thank you very much for a very nice discussion.
Thank
you.
Jihan, I guess the last question is actually will come from me. It's about the dual contrast particles that you showed earlier. So you mentioned that there's a T1 contrast and a T2 contrast material. Are these the same T1 and T2 relaxation time terms in NMR?
You asked whether they had the same T1 and T2 relaxation time.
I mean that you said that there's a T1 contrast and a T2 contrast. Are you referring to T1 and T2 relaxation? Is that the term?
Yeah.
I see. So then I see that in the diagram there's you use a ratio of 3 to 1 T1 to
okay, let me see.
materials. Why does it have to be a 3 to 1 ratio? Because
okay. Let me share the screen. So you mean this one, right?
Yeah, but there's the part where you show the diagram. It's a 3 to 1 ratio. There's 3 of the T1 contrast material surrounding 1 of the T2 contrast. I guess it's on the latest slides.
Oh, this one?
Yeah. Later. There's that one. So why do you need so many of the T1 particles?
We need lots of T1 particle because we want to have a strong signal. So let's say here, once the nano, so is it on the fresh clock, right? So the enzyme cut the peptide and release T2 material. So we have T1 material only. So if we have more T1 material here, then the signal we get will be stronger, right? It will be clearer.
I see. Thanks a lot. There's one last question from Matlum. I noticed a slide about the time-dependent accumulation of nanoparticles in different organs. The slide that shows after 7 days, the concentration of nanoparticles reduced to near zero. Did you carry out any size or shape dependent study as well? I'm curious, the nanoparticle size and shape.
No. So that one we just test for that particle. We don't vary. We don't test different size, different shape. Just one particle is the silver coated iron-oxide particle.
I see.
We just want to see whether the particle toxic to the mouse or not, and how long it stayed in the mouse. So that's why we did that experiment.
Okay.
But we did not vary the shape or the size.
Okay. Thank you very much, yeah.
Em nghĩ là phần Q&A chắc là mình sẽ end tại đây, và em xin cảm ơn chị Hằng với phần trình bày rất là thú vị và ấn tượng về vật liệu nano để chẩn đoán điều trị tim mạch ung thư với kỹ thuật MRI. Và để mà kết thúc thì chị có lời nhắn nhủ gì với các bạn theo dõi chương trình không ạ?
Thì chị cũng cảm ơn các em đã tổ chức cái buổi webinar này để chị có thể share cái nghiên cứu của mình cho các em và các bạn. Thì chị cũng không biết là ở đây các bạn là kiểu như là ở cái stage nào của cái career rồi, nên chị cũng không biết là nhắn nhủ như thế nào. Thì thôi thì chị nhắn nhủ với các bạn của VCA là những cái đóng góp mà những cái công việc mà tụi em đang làm thì rất là hữu ích. Và chị cũng có là coi những cái webinar trước đây của tụi em thì rất là hay. Thì chị cũng muốn các em là keep going on with the good work, thì continue this, rồi expand nó, make it better and make it stronger. Yeah, you are doing good work.
Cảm ơn chị.
Dạ, cảm ơn chị rất là nhiều. Sẵn đây em có cái chị có muốn giới thiệu về 3 vị trí PhD position của lab chị không chị?
Đúng rồi. Thì mình có, hiện giờ mình đang có một số cái funding thì cũng đang kiếm các bạn sinh viên, mà đặc biệt là mình ưu ái những bạn sinh viên Việt Nam. Thì nếu có các bạn sinh viên Việt Nam nào mà giỏi mà muốn tiếp tục cái con đường nghiên cứu sâu hơn để làm tiến sĩ ở bên Úc, tại Đại học Griffith, thì có thể là nhắn tin cho mình. Thì mình sẽ xem xét và sẽ giúp các bạn được học qua đây làm PhD. Thì hiện nay mình đang có ba suất như vậy.
Dạ. Một lần nữa em xin cảm ơn chị Hằng rất là nhiều, và cảm ơn mọi người đã ủng hộ và đóng góp cho nhóm ngày càng phát triển vững mạnh hơn. Thì nhóm sẽ gửi một cái feedback để nhận được sự góp ý cải thiện cho các buổi webinar tiếp theo, và nhóm cũng xin record cái video này và post video trên cái YouTube để cho mọi người muốn xem lại thì có thể xem lại dễ dàng á. Dạ. Chúc mọi người cuối tuần vui vẻ, và em cảm ơn mọi người rất là nhiều đã ủng hộ. Em cảm ơn chị Hằng rất là nhiều đã share những kiến thức rất là bổ ích cho nhóm và mọi người được nghe ạ.
Rồi, cảm ơn các em, cảm ơn tất cả mọi người.